Welcome, everyone. My name is Sarah Anstein. I'm the Director of Partnership and Outreach at the OneOhio Recovery Foundation. Thank you all so much for joining us for the last of our initial series of Impact Academy webinars. I'm really excited to have James with us here today from Prevention Action Alliance to talk about prevention. So as I mentioned earlier, this will be recorded and uploaded on the Foundation's website along with the PowerPoint slides. So if you have a friend or a colleague that couldn't tune in today, you can direct them to that. And you can always email us at the Foundation at info@oneohiofoundation.com. Be sure to follow us on social media and sign up for our email updates because we will be doing some more Impact Academies here in the near future to support everyone as they gear up to hopefully apply for a grant from the foundation. So as I mentioned, this is our Prevention Impact Academy. We are joined by James Syfax from the Prevention Action Alliance to talk about prevention, which is one of the OneOhio abatement strategies that folks can apply for. So without any more from me, I will turn it over to James.
Hey, thank you so much, Sarah. And thank you to everyone here. Looks like we've got about 150 people in the room. That is not an intimidating number of people to speak in front of publicly at all. So welcome everyone to the webinar. I am James Syfax. I'm with Prevention Action Alliance. We are based in Columbus. I see a lot of familiar names in the chat. So I think a lot of you might be familiar with the prevention space and familiar with us. But we are a statewide nonprofit here in Columbus dedicated to the reduction of substance misuse and the promotion of mental health and wellness. I am the community prevention manager here at PAA, as we call ourselves. So if you hear me say PAA, please know that that I'm referring to our agency, Prevention Action Alliance. And that is the first of, and if you are familiar with prevention, many acronyms that we will talk about in this over the next hour. Quite a few acronyms to talk about. So I would like to talk about what is prevention. And I know the chat is turned off, so we'll forego some interactivity. I could collectively hear a few of you sighing, even though you're unmuted. I could still hear the sighs of relief that there will be no interactive portion of this today. So let's talk about what prevention looks like. And our goal over the next hour is to talk about what prevention looks like, kind of that big picture definition, what we mean when we say prevention. We'll be talking about the prevention strategies, as most of us refer to them. We'll be talking about the CSAP strategies from SAMHSA. And then we'll be talking about some resources, some agencies you can connect with in Ohio, some of the things we do, some of the things our partners do, and how to just kind of learn about. And then if you want to take that next step, tap into some prevention activities here in Ohio. So I think the best definition or the best way to try to explain prevention is that we work upstream. We can think of behavioral health and mental health as kind of as the picture we have here. And I will tell you my background. I worked in substance use treatment. I worked in inpatient treatment just long enough to know that I prefer to work in prevention. So no knock to our treatment partners out there. But I'm a prevention guy. But for all of our treatment partners out there, we want to lighten the load for you. So imagine that our therapists, our counselors, our social workers, all of those treatment people are standing downstream, and we see people floating down the river, and they're yelling that they need help. And our counselors, our social workers, our therapists, they're going to jump in. They're going to jump in and they're going to save them. We've got our recovery specialists and our recovery supports and our peer supports down the road. They're going to help dry them off once our counselors pull them out. But as prevention specialists, we're going to go upstream. We're going to figure out where and why all of these people are falling into the river, and we're going to try to fix that. We're going to try to build a bridge, or maybe in a little more specific terms, put some protective factors in place that would keep people look at the specific situations where these people are falling into the river, and what specifically we can do to help them. And the things they need, we have to recognize may be different Different communities are going to end up downstream for different reasons. So through some investigation, through learning about some social determinants of health, we'll be able to better put into place some protective factors. So a little bit more, maybe a closer look about where prevention fits into the continuum of care. You see, we kind of fall after promotion, but before treatment and recovery. And we'll talk about that as one of the prevention strategies kind of butts up really right up against the treatment space. And it's an important distinction that if you're going to engage in prevention, if you don't have certain types of credentials, the screening and referral to treatment is an area that I like to point out, and I think a lot of people like to point out, where we might step outside of our scope of practice there. So I like to point out those kind of precautions in our work. But even inside the continuum of care there, you see that inside prevention, there are three opportunities or kind of three distinctions for prevention. We call these our populations. We have universal, selective, and indicated. Universal, and I'm going to use a little bit of my own work experience as some examples here. For years, I provided school-based mental health services. I served 2 counties, multiple districts, and then I also have served a few coalitions in various roles over the years. So my examples may rely on school-based or coalition work, but please know that when we're talking about prevention, we're not just talking about substance use. We're not just talking about the coalition building, right? We're not just talking about my specific examples. It's just informed by, or I'm sorry, my specific examples are not the only relevant examples, I should say. So we're looking at universal. So I think if we look at that school-based service, and we imagine going into a school providing prevention service for everyone, or for just the 6th grade. If we say, great, the 6th grade is a good touch point for signs of suicide, which I think that it is. That's a great universal program. Whereas a selective program may rely on some risk factors being present in one of those young person's life. We know that, for instance, children of divorced parents may require or could benefit from, rather, some additional support, some additional protective factors. Children whose parents may be interacting with the legal system or in recovery, in active addiction, right? Those home factors can play a role in prevention needs. So selective is a person or a group who have a higher than average risk, biological, psychological, or social, if we're developing a substance use disorder or any one of those other issues that we talk about in prevention. And then indicated is going to be where individuals identified as a minimal but detectable signs of an issue. And I'll say of an issue to be a little vague. I'll hone in and give an example maybe of substance use. Imagine someone has a clinical assessment. They don't meet the level of care needs for outpatient treatment, but maybe it was a young person who was caught at a party underage drinking. We don't want to put them in counseling if they don't need counseling, if they don't meet that level of care need. But obviously, something has happened in their life with them specifically that demonstrates they could benefit from a little prevention education. So that could be someone maybe who was caught using under the age of 21. A first-time DUI offender, even as an adult, may receive some sort of driver education or driver intervention program. So those really are right there for prevention education without the level of care need for treatment. And I've said risk and protective factors a few times. And this is normally where I would ask in the chat for a little conversation. But seeing some of the names that I know, I feel like there's probably a pretty good understanding of risk and protective factors in our audience. Risk factors, a characteristic at the biological, psychological, family, community, cultural, all those levels that we'll talk about again when we get to the social determinants of health and looking at where in someone's life prevention can take place, that are associated with a higher likelihood of problem outcomes. And different populations, different communities can have different risk factors. Different issues can have risk factors. We know that I'll use problem gambling as an example. A young person that engages in gambling behaviors or has a big win at an early age is 4 times more likely to develop a substance use disorder later in life. So that would be a risk factor. That's how problem gambling or gambling at an early age can be a risk factor. Age of onset for first drink, any other early age of onset for illegal activity, or really any age of onset for some of those illegal activities where we know abstinence is the only safe measure. Protective factors, um, kind of the opposite of a risk factor. One of those community characteristics or a factor or characteristic in any of those levels in a person's life that is associated with a lower likelihood of problem outcomes. So sometimes to go back to my problem gambling example, abstinence at an early age, especially in the state of Ohio, where we know that it's illegal to gamble at that young of an age anyway. But protective factors can be things like having a home that's free of substance use, having a home or a school or a community of some kind where you have strong social connections. And notice that's a community of some kind, and we'll talk a little bit about what community means in prevention as well. So again, risk and protective factors, early aggressive behavior, lack of peers, lack of supervision, socioeconomic factors, exposure to violence. As we talk about at the end of our time today, we'll talk about some state partners. The Ohio Domestic Violence Network is listed. We know seeing and being present to those things is certainly a risk factor. And this is just a very small sampling of some risk and protective factors. It really is dependent, and I would encourage all of you as you look at the problems of practice that you're working on or hoping to work on, that you examine some of those more specific risk and protective factors. But we want to talk about where prevention can happen, right? Where can we put in those protective factors and where can those risk factors exist? Because it's not just in someone's home, in the school. It really takes place. And if you are familiar with the social determinants of health, some of these levels should not be too unfamiliar. Right, so we have the individual level, the family level, the community level, and then the societal level. I would encourage all of you, it's I think to fit in some prevention information and to really do a deep dive into social determinants of health in an hour just isn't manageable. I would encourage all of you because social determinants of health are not a prevention specific topic to explore all of those on your own as well. A little bit about how we do prevention, because prevention is to people that may not work in this space could mean a lot of things. And while we shared the working upstream scenario that probably clicks with a lot of people, we'll get in a little more in depth about what prevention looks like, how it's done, and then also some of the things that maybe prevention isn't. So we know that most prevention is carried out using the strategic prevention framework. This is, and I see a lot of folks in the chat that I know are going to be totally familiar with the strategic prevention framework, or as we call it, going back to our love of acronyms and prevention, the SPIF. The strategic prevention framework. And this kind of outlines how or the procedurally how prevention can be done in your community. We look at this, we call it the flower. It is important to recognize that the strategic prevention framework is nonlinear. There's really no one start point. You can jump in depending on where you are and where your community may be. You can jump in at any point. You can be working in multiple portions of the strategic prevention framework at any given time on the same issue. So you may be building some capacity. We'll talk more specifically about what some of these things look like, but you may be building some capacity, recruiting new members, doing some training for your prevention efforts, where at the same time, maybe an executive committee is planning. Maybe it's an initiative that you or your organization or your community has done in the past. So at the same time, you have a team from last year working on some evaluation or assessment. So it's very possible that you're in more than one section of this at any given time, and that you can see sustainability and cultural competence there in the middle. Those should run throughout. When you're working on prevention, there's not a time at the end where you say, "Great, we've done our assessment, we've gathered we've built capacity, we have our funding, we have our partners, we've put this whole perfect prevention program together, and now it's time for cultural competence." If you're not concerned with cultural competence, and for those of you from small organizations or maybe organizations interested in prevention for the first time, sustainability is also a very important piece. We know that sometimes planning, and as we talk about readiness, those things can take time to build. So it's not that you always just get to jump in head first and say, "Hey, here's my program. Let's change the community." Sometimes, as we talk about assessment and community readiness, you as a professional may realize that there's more of an issue in your community than the community itself. Or sometimes, and as Sarah and I were talking before everyone joined, I come from a very rural community. And even though it's the same county, right, in a rural community, same grocery store, we all shop at the same Kroger. But in rural communities, there seems to be a dividing line between small towns where, that's the other town's problem. And it's really just an invisible line in a cornfield. So working with your partners, building your partners, planning to be sustainable, right? Working across systems, across sections, bringing everyone together. That really is a true and accurate picture of what prevention looks like. So be prepared. I guess is what I'm trying to say. To put some legwork in. Understand that you may know what your community needs. You may think you know what your community needs. Your community may think they know better than you. They may not be ready for change. It's possible that your community acknowledges the problem, but just isn't ready to change. So I really want to highlight that the importance of assessment, of capacity building, of building readiness, of planning, because there are a lot of well-intentioned new prevention ideas, and sometimes it takes a little more planning than we may suspect. And I say that from my own experience, is that it's hard to skip the some portions of the strategic prevention framework. So we also want to, as we're doing that legwork, we want to define the problem in the population. It's really easy to say substance use is a problem in our community, and say, well, we've defined the problem. Going back to the term community, and that it can mean so many different things for so many different people. Define that. In your community, is your community a physical space? Is it a geographic space? Is it a community, a town, a village? Right, as we may know that word. Is it a community of people of the same race, ethnicity, of the same spoken language, the same gender orientation, sexual preferences. There are a number of different communities. And just because you don't recognize them or may not recognize them as a community doesn't mean that there is not a community of people that exist in that, going back to that larger physical community, your town, your village, your city. You're in Ohio, you're unincorporated, unzoned townships, and I say that knowing that that's the part of Ohio I'm from, right? So you may not recognize them in your physical community, but that does not mean that these communities do not exist. And to borrow a slogan that I believe goes back to the days of advocating for Title IX, nothing about us without us. So as you, and I'm going to go back a slide, as you may be engaging in various portions of this SPIF, looking at assessment, capacity building, right, bringing cultural competence throughout them, all the portions of the strategic prevention framework really should have representative community members being a part of the process. Um, um, Someone has asked, do I consider harm reduction to be part of prevention? I will answer that as me, an individual. I advocate for harm reduction, and I think that's the best answer I can give. I will let Sarah chime in if she has a more specific answer as to how that might fit into working within the OneOhio system. I will always be an advocate for harm reduction, if you call that prevention or not. So that is my unofficial answer, Madeline, but I will allow OneOhio to give you an answer for their specific situation. Um, so defining the problem in population, um, and looking at so risk and protective factors, and then the impact of the issue in your community. And this is where sometimes it takes a little readiness building. Right, gauging community readiness is a really important part of prevention. Sometimes it takes a really traumatic event in a community to be that spark of change. It can be a tragic traffic accident related to alcohol, an overdose issue. Sometimes that can be the factor that sparks community change. There are ways, though, that through prevention science, you can raise awareness and increase community readiness without waiting for such a tragic spark in your community. So gather those things. Gather your data, look at the risk and protective factors that are there, begin to highlight some of those gaps in protective factors. Identify data sources. Whatever community you may be serving, begin to gather relevant data. Right, this goes back to the strategic prevention framework. We can't just say, hey, here's our program. Here's some feel-good commercials. Here's a billboard that says don't do drugs, without being driven by data to understand the population we want to serve and the problems they're facing. Those prevention efforts may be less than impactful. It's also really important to research community and historical context, because sometimes prevention takes place by people that don't live in that community. I'll use myself as an example. I'm from Brown County, southwestern part of the state, designated part of Appalachia, very rural part of the state. I served Clinton County, one county just due north. Demographically, socioeconomically, for all intents and purposes, very, very similar. However, I was not from the place that I served, and I lacked that historical context. So while someone from the agency that I worked at may have been able to give me some insight into previous prevention efforts, attempts, whatever that community may have been through, it's important to gather that data as well. Because if you do all of your data gathering and your hard work and you show up and you say, hey, this is what we need. This is my professional, we've used the strategic prevention framework, and this is what good prevention should look like in our community. And they say, oh no, we tried that 10 years ago. Didn't someone tell you? And if no one has told you that, And maybe the last time that that initiative or whatever it may be was tried, it wasn't tried to the level that you're about to try it. So it's left a bad taste in their mouth. So you have to be aware truly of all aspects of the community that you're attempting to serve, to make sure that you're meeting their needs, and that you are not offering something that they may have already said no to, or just didn't, in any way, not necessarily in a bad way, but something that didn't meet their needs in the past. And then I really like to talk about capacity, because capacity sometimes, um, people, it can mean just building partners, and people sometimes will recruit partners. We'll build an initiative and we say, my gosh, we have 10 new partners. We have, look at all these people that we brought to the table. But if we bring people to the table and we bring them into our prevention efforts, and we don't educate them on what prevention is, have we really built a lot of capacity? So capacity building doesn't just mean bringing people to the table. It means determining their needs as individuals. Looking at a coalition is a great example. If you have a coalition member that's very excited about an underage drinking initiative, but doesn't understand the science of alcohol consumption. Um, that's a missed opportunity. If you have coalition members or agency partners, whoever it may be, I'm sure all very well intended by coming to your meetings, being part of your efforts, um, but educate them on prevention as well. So just, we have currently 164 people. I'm going to imagine, in a perfect world, everyone in this session will leave today and go kick off some amazing prevention initiative in their community. Um, there should be more than 164 people across those initiatives that understand the science of prevention. So educate your partners not just on your goals, but also on prevention. That is true capacity building. Now we'll talk a little bit about what prevention actually looks like, how we do prevention. And prevention is really guided. And I know we're going to talk about problem gambling. We're going to talk about, or prevention does talk about in Ohio, problem gambling, suicide, and intimate partner violence, um, um, many more topics than substance use. But the science of prevention really does come from substance use, or at least has a longer history of research. So we're going to look at SAMHSA, the Substance Abuse and Mental Health Services Administration. They have what they call the 6 CSAP strategies. Going back to our love of acronyms, CSAP is the Center for Substance Abuse Prevention, part of SAMHSA. And they have these 6 strategies that kind of detail substance use prevention efforts, or the best way to kind of implement some of these efforts. Um, the 6 CSAP strategies, we'll kind of run through. We've got about half an hour left. We'll hit on them quickly. Please know that I will share some resources, including how to contact us here at Prevention Action Alliance. If you have more questions about just is this good prevention? Is this prevention at all? Is this effective prevention? Feel free to reach out. Right, this is our bread and butter. Connect with us. Let's talk about your prevention efforts. But we have information dissemination. It's a very basic form of prevention. It's one way. It's very one way. Can be direct or non-direct. So think of that as getting handed a leaflet, a flyer, right? Walking by a health fair, grabbing a resource bag. That's one way information. So that's information dissemination. Used mainly to raise awareness and knowledge about the extent of issues in your community, or it could even be to kind of prime the pump for specific efforts that you may be kicking off. Um, And I will say we will get to another strategy where we talk a little bit more in depth about prevention education. Community-based process. Community-based process develops skills of impactors who in turn provide awareness. Um, that sounds like a coalition to me. So much so that I have a hard time thinking of anything else as a community-based process. But there are there I use the term coalition, and this is something Sarah and I were talking about earlier, is that depending on your community, right, you may have a task force, a work group, a coalition, you may have a panel, a committee. Those are all examples of community-based processes. But if we look at the definition here, develops the skills of impactors. So that kind of goes back to capacity building, where we're not just talking about bringing partners together to make our efforts more impactful, but we're truly talking about training our partners on the things that we're working on. It's great that you want to work on the initiative, but if you don't understand the protective factors, the risk factors, the way this issue specifically impacts our community, we need to educate you on that so that you can better help us help the community. Problem ID and referral. And this is one that I mentioned that this kind of skirts what we as prevention specialists can do. We cannot treat, we cannot diagnose. What we can do is screen. We can do non-clinical screenings. Right, so we can do a screening, and we can suggest to someone that they do get an actual clinical screening, right? That they need to see a therapist, should get an assessment, right? We can make this problem ID and referral. The word referral, I think carries maybe a little more clinical weight. This isn't a referral for insurance purposes, but you're suggesting merely that your skill set has someone who has knowledge of substance use disorders, the way they can impact people and communities, and with the use of a screening tool, can suggest that someone seek additional. And you can even provide, and I would encourage you all to rely on whatever your agency or institutional policies may be for this, but you can provide those resources. You cannot provide an assessment. I always like to point out, though, that there are a lot of people in prevention and social work and counseling that have multiple certifications. Sometimes you pull people out of the river, sometimes you might fix the bridge. You may see people that have a prevention credential providing an assessment. That means probably that they have those proper credentials. So I like to point that out because you may see someone else doing it, but we need to trust that they're relying on their credentials outside of the prevention space to do that. That does not mean that all prevention specialists can do clinical assessments. It's a very important point to make. And I would even clarify to say that when they're doing them, they're not doing them as a prevention specialist, but as an alternatively credentialed professional. Alternatives. So a great alternative activity I like to point out, because this is an example of where we can do prevention really well, but also how well-intended prevention can maybe slip back into some accidental risk factors. A great alternative activity, an alternative activity is an activity provided for targeted populations that exclude alcohol, tobacco, and other drugs. So think of after prom. After prom, where everyone may come back to the school or a supervised, intentionally drug and alcohol-free space with adult supervision. They're providing an alternative activity to unsupervised possible substance use. We do see sometimes that after proms, while themed and themed well for a lot of great events for the young people we serve, taking away the drugs and alcohol and introducing Monte Carlo night and a night of gambling and just a different set of risk factors is I think, a great example of off to a good start, but without really investigating, what is good prevention. And it is worth looking at what is bad prevention, or what is less than desirable prevention. I think is a fair statement, because knowing the dollars that we have, we really want to maximize those. And if we're doing prevention that has been shown to be ineffective, or to even scare people, we know that scaring people is pretty ineffective. And something like a scared straight, a mock car crash, those types of things are, while very emotional and emotion driven, from the standpoint of prevention science, not necessarily the best practices. Prevention education. Prevention education is two-way communication. That's kind of the next step after information dissemination. Going back to a school-based example, life skills, too good for drugs, too good for violence. Those are all great examples of prevention education. Looking more at some of the adult populations. I know I referenced earlier, like a driver intervention program. Um, that can be a great, or one of those, for someone that meets the need for, not the level of care need for treatment, but for an indicated prevention service. This is a great place for prevention education, where you don't need counseling, but there is some information that I can give you that will hopefully help you make better, healthier decisions. And environmental prevention. Environmental prevention is I will say, my favorite prevention strategy, which is how you know I'm a little bit of a prevention nerd, that I have a favorite prevention strategy. But it's also one of the most broad. And environmental prevention can look at modifying systems, policy, law, advocacy is a big part of prevention. I think that comes into play here in environmental prevention. And when we say changing policy, we're talking big P, little p policy, right? So those are your local kind of norms, things that may not be law, your social norms, your community behaviors. And then big P policy, we're talking about changing that too. And those are laws, legislation, reminding and educating our 132 legislators here in downtown Columbus, just about the need for protective factors. We don't go to them and say, we need you to pass this law, we need you to vote this down, but providing education to those legislators allows them to make more informed decisions on what they're passing. So we do talk about everything from just kind of those social norms in your community, right? Those things that may be illegal in your community, but you say, well, that's how it's been. And in small town Ohio, there's a lot of that. So working to change those things, and then working to change the big P policies as well. Access and availability is definitely an environmental factor. Media messaging, counter messaging to media messaging is a prevention strategy. So environmental prevention is a broad sweeping category. If you'd like to learn more about environmental prevention and what some of those specifically may look like, I'd encourage you to reach out. We could do probably a day just on environmental prevention. And this is information I always really like to share, and I'm going to drive this home. So that means I'm going to say it 2 or 3 times. Is that when we look at these strategies, we know that prevention education and environmental prevention strategies can be impactful on their own. So that means that we can give, and there are evidence-based programs. We can go into a school and do a 6-part prevention education program. Like one that I mentioned, Too Good for Drugs, Too Good for Violence, life skills, just to name a few. We can take those prevention programs, provide no other prevention strategy in someone's life, and they will demonstrate a net benefit. There's a positive in their life, right? They can have a positive outcome from just that prevention education program. Or just an environmental strategy, right? We know that we can change if we changed a law about the density of alcohol outlets in the state of Ohio, or if we changed a law regulating the hours that an alcohol outlet can be open. That will, of course, have a major impact on someone's life. So those as prevention strategies can stand alone. The supporting strategies, which means that they are ineffective on their own, an alternative, community-based process, information dissemination, and problem ID and referral. And I know they're great strategies. We want you to engage in them. We don't want you to just engage in them, or we don't want you to engage in just one or all four of these without one of the other two strategies that can be those stronger, more standalone strategies. You know, a good way to look at it is that if I had $1 million in prevention funding and all I did was to put up billboards and hand out leaflets to make people aware of an issue in the community, we probably wouldn't get a lot of change. If I were to even just hand someone a flyer that says "Don't do drugs, drugs are bad," right? And that's very simple, an oversimplification. But we know that prevention through leaflets, billboards alone is pretty ineffective. A coalition is a highly effective tool for a community to have. I encourage every community to engage in the coalition process. But a coalition that doesn't incorporate any other strategies is just a bunch of people in a room talking about substance use. So it's where, it's the other strategies that the coalitions elect to do and to carry out in their community that really bring home the protective factor building value. So important to remember that as local funds, as other funds may become available for prevention, there really is a kind of I don't want to say a hierarchy, but a definite system that prevention should be used to execute or implement prevention in your community. For those of you that may have interest in becoming a credentialed prevention specialist, a certified prevention specialist in the state of Ohio, I would encourage all of you to check out the Ohio Chemical Dependency Professionals Board. Pardon me. So sorry. The Ohio Chemical Dependency Professionals Board offers a few options for becoming a credentialed prevention specialist in the state of Ohio. They do also, and I just like to recognize, they coordinate the licensing for the chemical dependency counselors, so CDCAs, all the way up to LICDCs. They also work with the GAM endorsement. So if you're a social worker or a counselor in the state of Ohio, you can adapt to have gambling in your scope of practice. If you're a chemical dependency counselor, we very much need you in the state of Ohio, and I'd be happy to speak to anyone that would be interested in learning more about how to treat problem gambling. That's an endorsement that you can have. So those things are all, I just want to give the Chemical Dependency Professionals Board their due. So they work with the treatment providers, but also prevention specialists. And you can see there are 4 levels of prevention credential in the state of Ohio. Registered applicant, that is kind of just the initial door you have to walk through to pursue other levels of credentialing. The Ohio Certified Prevention Specialist Assistant, you can earn that with some continuing education and a high school diploma or equivalent. The Ohio Certified Prevention Specialist, OCPS, and I will say these do have a mix of education, continuing education and practical hours that you need. I'm just hitting on those education specific, right? The things that may be barriers for people. The Ohio Certified Prevention Specialist credential, you need at least an associate's degree for, and the Ohio Certified Prevention Consultant, you do need a 4-year degree for. And happy to, I actually have the privilege of representing Prevention Action Alliance on the prevention committee of the Ohio Chemical Dependency Professionals Board. So I get to be privy to some of these the rulemaking process and the regulations for prevention professionals. That also means that I get to hear how many prevention professionals we have when we have our quarterly meetings. And I can tell you that we have more certified prevention specialists in the state of Ohio because it's a common test, a shared test. Other states that recognize prevention as a certified occupation or a certified credential, we take the same test. So with that data, I can say proudly that the Ohio prevention system, we have more prevention specialists in the state of Ohio than any other state that takes that test that certifies their prevention professionals. Ohio also has, as that's an international test, Ohio alone has more certified prevention specialists than any other nation that administers that prevention exam to their certified professionals as well. So the prevention system in Ohio is strong. I encourage all of you, whatever your interest in prevention is, and it has to be greater than 0 because you're here. I would encourage all of you to learn more about becoming a certified prevention specialist. And again, please connect with PAA if that's something you have a question on. You can also visit ocdp.ohio.gov for more information about becoming credentialed. Last thing I want to talk about is some opportunities to connect. We've got about 15 minutes left. I will talk about some opportunities to connect with PAA, Prevention Action Alliance. We'll look at some other partners around the state. And then I will name drop a couple funding opportunities that folks may be interested in as well. So inside our organization, and all of these things can be found at preventionactionalliance.org. Or please connect with us on social media. We have, in alphabetical order, we offer an advocacy boot camp. I mentioned that advocacy is a part of prevention. So prevention can look like everything from doing a school group to going down to the State House and providing testimony sometimes. So I think that's also a really good example of just how much is in prevention. How if you have an interest in doing more, there's a place for you. And even if you just want to build your capacity, right? Maybe you are in the school-based kind of sector of prevention and you want to build those skills. Please, we offer advocacy boot camp. We train folks on everything from kind of basic Ohio civics all the way up to providing mock testimony on how to go down to the Rife Center and testify in front of a committee. The GAP network is Grief Advocacy and Prevention. We offer resources for those in Ohio that have lost a loved one to substance use, to suicide, or even incarceration, to a behavioral health issue. We call those stigmatized grief or forms of stigmatized loss. We have a great grief conference coming up here in just a couple weeks. I believe we may still have a couple seats for that left. If anyone is interested, please connect. We offer no prevention tips. These go out twice a month. We know that in Ohio, there can be some, I will say in Ohio, we know that kinship care is an important issue. We know that there are older adults that might be raising a child because of substance use or incarceration or suicide or one of those kind of connected behavioral health things. We know that kinship care is an issue. And if you're a grandparent, an older aunt, uncle, whoever it may be that hasn't possibly ever raised, or it's been years since you've raised a young person, we know there's a lot going on in their lives as well. So looking at those protective factors, going all the way back to one of our first slides, and looking at the power of connection. We know that those conversations, if you haven't raised a child or it's been a while, having meaningful conversations can be hard. We want to help. So no prevention tips go out twice a month. You can sign up for them. They'll come right to your email. You sign up for them on our website. They're free. We partner with the Ohio Department of Education. These go out to every district in the state. And then kind of anecdotally, we'll be our staff will be at conferences, at events around the country. I just met someone from Charleston, South Carolina last week that knew exactly what no tips were because their school sends them out. So it's a great free resource on topics meaningful to young people and how you as an adult can have some of those important conversations. Ohio Adult Allies is a great, and I will tell you that my own personal background, I've talked a lot about school-based, providing, school groups and working in coalitions. Professionally, I need to learn more about how to work with young people in youth-led prevention. There are so many great youth-led prevention initiatives across the state. If you have an interest in learning more about working with young people as youth leaders in prevention, please reach out. That is literally, I'm one of the two program managers at our organization. I will shout out Juliana Fellows, our manager for kind of the other half of our programming team, working with youth and young adults. So if that is an interest, please connect and we'll be happy to connect you with the Ohio Adult Allies. I'll skip ahead. We have the We Are Change rally down at the bottom, formerly known as We Are the Majority rally, a great youth-driven event here in Columbus we have every year. I think last year we had over 1,000 young people around Ohio coming to Columbus with their adult chaperones and leaders to celebrate the fact that the majority of young people in Ohio are substance free. So we want to build those skills as well. The Ohio College Initiative for Student Wellness, right? Prevention takes place across the lifespan. Prevention is not just an elementary school or middle school driven activity. So you can see here, we truly have activities or services or networks or programs, some way that you can interact with us, no matter where you are in life or where those people you are serving are in life. Looking at some other resources around the state, we have the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. And these are all great organizations I'd encourage you to connect with. If you Google any of these, right, as I know it can't be a clickable link over a webinar, I would just encourage you to Google. If you can't find them, shoot me an email. Happy to connect you. But we have the Ohio Domestic Violence Network. Right, we know looking at those risk factors that they don't exist in a silo. We know that things like gambling can impact suicide and intimate partner violence can impact school, or I should say having to witness, intimate partner violence in a home can impact school success of a young person. There are so many cross-connected risk and protective factors that I really want to highlight that you may be interested in substance use, but it really is worth looking at some of these topics in the periphery. The Ohio Prevention Professionals Association is a great organization just for us as prevention professionals to connect and collaborate. The Ohio Suicide Prevention Foundation and the Problem Gambling Network of Ohio. And I will say that the Problem Gambling Network of Ohio is the state affiliate in Ohio for the pardon me, for the National Council on Problem Gambling. And I mentioned that, pardon me, I mentioned that because I would be remiss as we were talking about some funding opportunities, not to mention that PAA has a funding opportunity around problem gambling prevention. So if you are interested in problem gambling prevention, please check out our website or reach out for more information. And then I think locally, to talk about resources, but to talk about some funding opportunities as well. In the state of Ohio, I would encourage you to reach out to your local and depending on your county or the county region that they serve, your local ADAMIS board or mental health and recovery board, if you are interested in prevention, they're going to be able to tell you, they can paint for you a picture of what prevention might look like in your community. They can talk about the prevention providers that they fund, their goals, what their strategic plan may be. if they have one. And I would encourage all of you to, if you are interested in connecting or learning more about prevention and aren't currently a part of that local prevention system, I think that's a great place to start. They are also going to have some prevention funding available. I am certain there are probably some Adamus board or board staff here with us. I don't want you to think that I'm sending everyone your way. So I will clarify for everyone else, right? These are funded, they have funded providers for treatment, for prevention, usually for crisis services in your community. So start there, see who they may already be funding, reach out to them, see if there's a local coalition, what some of those efforts may be, and how you can get involved in an existing effort. Because am certain, and I know that there are communities in Ohio that may have a prevention coalition, a task force for, a fentanyl task force, an opioid work group, and it's the same people. Just meeting in different buildings. The first Monday of the month, you might meet in the basement of the library. The second Tuesday of the month, you're at the hospital boardroom. There's so much duplication of efforts, that it really is, I think, super important, to start there, see what's already taking place in your community. And I know that many of you here are the people who are well aware of what's taking place in your community. So please, hopefully, you will be able to build some capacity from the other attendees in this session reaching out to you as well. And then I really want to hit on CADCA. I think I would be remiss not to talk about coalition building and my experience with coalition and how beneficial coalitions can be in bringing together community sectors without talking about how to engage kind of the coalition system. Locally, here at PAA, we have the Statewide Prevention Coalition Association. If you're a prevention coalition of any kind, we encourage you to join us. Membership is free. We provide training and technical assistance through a series of meetings and trainings throughout the year. All of that driven by an advisory council made up of coalition leaders from around the state. So if you're interested in joining, please connect with us. If you're interested in joining the advisory council, please connect with us, as we do have some open seats on that as well. At the national level, there's an organization called CADCA. CADCA.org is their website. They have recently changed within the last year their acronym from something that used to be more manageable to remember to one that I can't precisely remember right now. It is many words. So please check out CADCA. They are kind of the national version of SPECA. They're going to have a lot of great information, and they have, and I named them specifically because they have some documents called the community primers. And these are great if you're interested in community organization. They are some great resources. We have printed copies available for free in both English and Spanish, thanks to support from the Ohio Department of Mental Health and Addiction Services. They're available online for free, or you can connect with us for a printed copy. But part of that national coalition system is a coalition grant. Formerly administered by SAMHSA, now the CDC. It's called DFC. It's a Drug-Free Communities Grant. And that offers currently $125,000 a year for 5 years, renewable at present once, but I know there's going to be a push soon. And again, to talk about the importance of advocacy and prevention, this is some federal advocacy. There's going to be a push soon to make that renewable for a total of 2 times, so it would be 3 total funding cycles. There are a high number of DFC coalitions inside the state of Ohio. SPECA, on our website, preventionactionalliance.org, we have a coalition directory of all coalitions in the state of Ohio, or all of our members in the state of Ohio. The DFC grant has a directory online of DFC funded coalitions around the state. So please, in the interest of reaching out, look for a coalition in your area. If they are funded, great. If not, please keep this in the back of your mind as a funding opportunity as well. And I mention that because I I know this is the One Ohio Impact Academy. So I believe there's probably an underlying interest. So we just want to make you aware of some of those other high dollar and really specific for coalitions. So it really is a great funding opportunity for coalitions. So I just wanted to make you aware of some of those other opportunities, the other agencies in the state of Ohio, other organizations that I know. I know someone that where at least one person that works at every one of these organizations. They would love to hear from you. With that, I will invite Sarah to come back on. I know we are right at time, so I apologize for that. But I see we've got a couple questions. I will first of all shout out my friend Charlotte for putting the new CADCA acronym. It is a community-based, advocacy-focused, data-driven, coalition-based association. So that is why I could not remember that. Thank you, Charlotte. Um, so, Sarah, are you okay if we do a couple questions, or
Yeah, let's do
do
a
you want to?
couple, and the folks have to
All
hop.
right.
The hop.
Yeah. So I see somebody asked, what does promotion mean? Why is it at the bottom of the chart? Don't think of it as being at the bottom of the chart, but just on a continuum of very broad to very specific. Promotion is going to be just the kind of the most broad, and that's not the space I work in. So I'm afraid that if I gave a definition, it would not be accurate. But think of, right, if we look at universal prevention, go a step bigger, and that's going to be just some very general, very public health messaging, the promotion of healthy behaviors. It's when we get into prevention and treatment where you may exhibit warning signs or actually have a diagnosis for an issue, where we hone in on more targeting more specific health behaviors. Do public health staff need to be certified in prevention? Well, I think that's a great question. I'm going to put on my prevention specialist hat and say I think everyone working in prevention should be a certified prevention specialist. Um, there is, I will say, depending on the organization you work for, depending on the funds they receive, and how that, I will say if you receive federal DFC funds, you have different stipulations than if you receive possibly Ohio Moss funds, and if you're a coalition or if you're a 501. So I would, Diana, for the purpose of your question, outside of me just saying yes, I think everyone should be a prevention specialist. I would maybe ask more specific questions about funding or who you're reporting to or what the specific work situation might be, about a true need to be. I know that was a non-answer. Is there grant funding offered to provide prevention services through our agency? Advice for how agencies usually get paid for services. Well, so I will say through Prevention Action Alliance, and this is really the only answer I'm really best suited to give here, is that sometimes we do. So we have, I mentioned our problem gambling funding, that is called the Community Integration of Problem Gambling Prevention. We have a project once a year where we call it Capacity for Prevention. That though just closed a few months ago. So we do have some small funding opportunities. I would encourage you to connect with us, sign up for our newsletter. What we're going to have more of than just those straight funding opportunities. I'll use the Ohio Coalition Institute as a great example. That we would be more, I think, more inclined to have learning, the opportunity for a learning community that has a stipend attached for participation, where if you learn prevention or go through a coalition institute, or other series of training or learning community, you could receive funds for that. The just general grant funding is more rare with us. And I see a compliment from my good friend Kelly Garza at the Zeph Center in Northwest Ohio. So I will not read that, but Kelly, it's good to see you.
With that, we can go ahead and wrap up. I know I took a page full of notes. James, thank you so much. This was incredible. And I know a question had kind of been asked earlier, like what do we mean by prevention? What do we mean by harm reduction? And I did want to direct folks to the OneOhio Recovery Foundation website. On our grants page, there is a document titled Funding Priorities, where we list out what we mean by all of these things, because both prevention and harm reduction are an approved abatement strategy that we can fund. So we actually have definitions of those on our website, and they will be in the grant portal as well when folks go to apply, because we want to make sure, folks are, that we're all just kind of speaking the same language when it comes to what you kind of select as your abatement strategy or funding priority in the application. So I did just want to say that there, and we give some examples of what we mean when we say those things in there as well. So as always, this webinar was recorded. It will be posted on our website along with the slides. Thank you again, James, so much. This was incredible. Thank you all for staying with us, and we will see you at our next event. Have a great day, everyone.